right, welcome to the Deuk Spine Institute. It is October 3rd, 2023. Our final patient for today is having the Deuk laser disc repair at L5-S1. He has a herniated disc at 5-1 with lots of back pain, and we're going to go in there and fix that for him. All right, you see I'm going to talk to Jordan for a minute. We're just a little off. You see the rabbit's ears on the L5 supraarticular process? If you can just fix that for me. Now, for those of you who have not watched us do this surgery, what do you think about what do you think that is? Is that a double pedicle? It's kind of hard to tell, right? I think that's worse. I don't think it's an orbital issue. I think you got a WAG issue. Now, you might be okay, so remember where you are right now, but to me it looks like there's a double line under the L5 pedicle, which means you could be off on WAG. That's way worse. So folks, if you're doing spine surgery like I do, oh, that's really good right there. You've got to get your x-ray perfect before you get started. Now, I've already put the needle in, that's okay. But before you actually get close to where the nerves are and the discs is, you need to really get your x-ray perfect. All right. Shot. All right, so I'm going to adjust where I'm at. Shot. 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 Is he reliable? Shot. AP. You're doing great. Perfect. So on the AP view, we're at the mid-pedicular line. Show the audience on your blurrogram AP. Go ahead and look at the x-ray. There's the L5 pedicle. No. Yes. Circle it. Perfect. And there's the S1 pedicle below. Yep. And if you go from middle of the pedicle to middle of the pedicle, there's a line. And that's kind of where the needle tip is. We're just about there. That means we're at the disc. Okay. So, are you okay?
How you doing, my friend? You all right? Still a little sleepy? Can you open your eyes for me? Good.
All right.
We're going to ask you some questions. Don't move.
Let me know when he's a little more awake. I want him perfectly awake.
All right. We're going to ask you some questions, all right?
So when I asked him,
Open your eyes.
where is your pain? This is where he put it. This is the L5-S1. Thank you. And he's got a herniation there. You comfy?
Don't move your hands. Don't move this.
Don't move. Just talk to us, all right? You're in surgery.
Don't move.
You move, and it could be no more piano playing for you. All right. Are you having any pain? You guys like that? No more piano playing?
Sir, can you open your eyes?
We're not doing brain surgery.
Okay. We're going to ask you a question, all right? Are you having any pain in your legs or your back? In your back? Tiny bit of pain in your back? Okay.
You're doing great. All right, so we're in 5-1. It's perfect. Yep. So at this point, I need him fully awake so I can verify that this is indeed the cause of his pain. We do that with a discogram. How long has he had back pain for? 5 years. He's had lower back pain for 5 years. Now he's Canadian. And we like our Canadian patients. He's from Toronto, near Toronto. Okay? So they've got great Indian food in Toronto. Really good Indian food. They got Niagara Falls, right? They got the CN Tower. If you've ever never been in the CN Tower, it's got great views. You can actually go there and have dinner. Am I right? Have you ever been to the CN Tower?
No.
No. Am I missing something? Oh, but maybe he knows something I don't know. Maybe there's something even better than the CN Tower. Where's your favorite restaurant in Toronto?
Favorite place?
Huh?
What was the name of it? Can't hear the name. I think he's got a mask on.
Oh,
What did you say the name was?
num num.
The Good Spot?
The good spot. The good spot. Little numbing medicine, don't get upset. The good spot. What kind of food they have there?
Italian.
Ooh.
Yeah.
What's your favorite? Mine is lasagna. Yeah, but what's your favorite food? Like, what kind of dish do they
What
make?
do you like?
Huh? Chicken Alfredo?
Yeah.
Fettuccine Alfredo. Great dish. Are you having any pain right now? Where?
In your back? Can you send it in his
All
back?
right. How bad is that on a scale of 1 to 10?
What's the number?
What's the highest?
9, he said.
Is that where you get your back pain? All right, did you guys see how he jumped? Like his whole body came up? You get to go to sleep. When you're done, when you wake up, we'll be done. He has a 9/10 concordant at 5-1. So that's great news. We found the source of his pain. Now, had I injected another disc like 4/5, 3/4, which are normal, he would not have had any pain. But because I injected the right one, because we're treating the proper one, that's the L5-S1, he had a lot of pain. And we know that he likes fettuccine Alfredo. All right.
Okay, let's get you off to sleep, my friend.
How long are you in Florida for? Huh? All right, make sure you ask me about my favorite Italian restaurant in Orlando. Okay? It's called Cristini's. It is unbelievable. I think you should be a little more north on your
I like
fluoro.
Amici's here. It's pretty good.
Amici's is good. Yeah, but it's not Cristini's. Cristini's is
Yep, whatever.
literally world class. People come from all over the world to go to Cristini's.
Nah, they don't
I knew Chris, the owner, for years. How's blood pressure?
Good, tremendous.
Good? Blood pressure good? It's too high or not? No, it's good.
Just off the-
So he's basically on something that thins the blood. Num num. Yeah, you got to be careful when grabbing these things. See how the needle is up? You always want to look, where's the needle, okay? Never put your hand where there's a needle. Is that it? So I'm going to give him a little num num because Dr. B likes that. Henry, do we have any questions?
Yes, we have two questions. This first one comes from Lubisa on Facebook.
Lupisa, very nice of you to join us. Lupisa on Facebook.
They
Shot?
they ask, what do you think about stem cells for degenerative discs?
Yeah, stem cells do not work for degenerative discs. We've tried it. We do stem cells here at Deuk Spine. It doesn't work. It actually makes it worse. I'm going to go ahead and advance. But it's a great question. Stem cells, for those of you who don't know what they do, stem cells are a lot of hype, okay? Stem cells promote inflammation. They make more inflammation. Okay, think of stem cells if you have a forest fire that's burning and you want to stop it. What you do is you actually burn the forest around the forest fire, and it stops the fire from spreading because you've already burnt it. Stem cells are like that. They promote inflammation. Inflammation is what causes pain. So by promoting inflammation, you actually burn out the area just like you would burn out with a control fire during a forest fire. Okay? It just doesn't work. That's the problem. We've tried it, and it doesn't solve the problem. Great idea, though. We've tried stem cells for things like hips, knees, shoulders, and it actually works pretty well for those things. Shot? Boy, I'm hitting my own hand.
Sure that's not Luis's?
No, it's not Luis's. It's mine. If it was Luis's hand, I wouldn't be hitting it. I only hit my own hand. Okay, Henry, let's show our audience why do these disc things cause so much pain. Speaking of inflammation, when you come back, we'll be inside the disc and we'll be starting to clean it up with the laser. All right, in case you just joined us, our patient is from Canada, Toronto. His favorite restaurant is Italian. He recommends the, what is it called, the Good Place? The Good Spot. The Good Spot. I don't know, Luis, what do you think about this? It looks like there's already a lens issue here, huh? Did you just get this back or what?
No.
Never been sent?
No, this one no.
Is this a used one?
We
I don't
haven't
remember
used
that
it.
time that we used it.
We haven't used it, so it's still in the list.
All right. You could see from our video we showed you that what causes the back pain when you have what's called discogenic back pain, discogenic just tells you where it comes from. It comes from the disc. If the back pain came from a facet joint, we'd call it facetogenic. If it came from your knee, we would call it neogenic pain, you know? And basically, you put a word like facet, and then you put ogenic, and that just says where the pain comes from, or where something originates. So facetogenic pain is pain that originates from the facet joint itself. All right, we're now using our laser, and let's show the audience exactly how the Deuk laser disc repair works. All right, welcome back. As you can see from the video, the Deuk laser disc repair is a minimally invasive surgery that we go into the tear and we basically use a laser to remove scar tissue, calcium deposits, herniated disc, that's stuck inside the tear causing the inflammation, which then, of course, causes pain. So basically we call it a debridement. So we use the laser to do a debridement of the annular tear. The grabbers that I'm using are used to try to mechanically debride. So we use a combination of thermal debridement with the laser. It's not really thermal. It's actually not hot at all. It's just delivering energy to the tissue. We don't heat the tissue up. So there's no thermal component. But it just delivers powerful laser energy to the tissues that are damaged, like right there. You guys see that? See that pink right there? That pink is the inflammation. And that is caused by this stuff right here, which is the herniated disc stuck inside the annular tear. When I get rid of this, his back pain will go away. We're the only ones in the world doing this procedure. Yeah, Luis, there's something wrong with the lenses. I mean, check it out yourself. You got to look at these things.
When we don't use the laser and we check in the white balance and everything,
It
looks
looks
actually
great.
good. It just, when you start, you know, the wave and all that stuff, it's just like a little like that.
Really?
Yeah, yeah, yeah.
All right, Henry, I know you got more questions.
Yes. This next question comes from Vitality Approach on YouTube. And they asked, have you seen dancers and or athletes get back to their old lifestyles, or do they have to modify forever?
No. Vitality Approach. Great questions today, by the way. We enjoyed it. No, when you have this surgery done and the pain is gone, you just got to give it a year, and then your disc will be completely healed. You can do whatever you want. You can go back to pro football. You can be a lineman. You can be a tackle. You can be a quarterback. You can be a neurosurgeon. I mean, there's nothing you can't do once you've healed from this procedure. The key is to give it a year to heal before you do too much. And that's something that a lot of people just have a hard time, is restricting their activities for a year. But you got to do it. Now, if you don't restrict your activities, you're probably going to be okay, but there's a much higher chance that you're not going to be okay. See that, Luis? No, I'm okay. We're done, but I'm almost done. No. I need another minute. But I'm just showing Luis. You got to look for those kind of, I don't know what you call them. Stranding, right? So what's amazing is this patient has been suffering with back pain for 5 years from this disc being injured. And in 15 minutes, we're going to fix it for him, and that pain's going to be gone. And all it takes is fixing this small little area inside his disc. I need the grabber. All right, you got more questions there for us, Henry?
Yes, we do. These next two are from, I love this name, Bullseye Savannah Cat
Nice.
on YouTube.
I like it.
First question is, are you able to determine if the annular tear is degenerative or recent?
Yes, I can. You got to give me the right one. The annular tear in this case is degenerative. It's very old. It's been around for a while. I could tell because of the amount of scar tissue I'm seeing. I could tell because of the amount of collapse of the disc that I'm seeing. And I could tell by the bone spurs that you see. Okay, there's some bony erosion going on. All right, so and scar tissue, calcium, collapse of the disc, bone spurs, and the amount of scar tissue really is important. The longer the disc herniation's been there, the more scar tissue there will be. This is at least 10 years old. Now he says he's had back pain for 5 years, but I think this has been going on even before he had back pain, you know? He probably had injured his disc a long time ago, and then the back pain came later. This is fat tissue right there. You see a lot of fat tissue around areas of inflammation, which he has for sure here. And the reason is that inflammation is very energy intensive. It needs energy. So you've got to have a source of energy nearby. And your body puts fat where it needs lots of energy. It just puts fat deposits. Little fat deposits. And that's what he's got. Okay, we're done. I'm done. I'm going to come out. Just finishing up my last bit right here. Very happy with the way the surgery went. It went very well for him.
Sitting on, please. Thank you.
His nerve is just buried in that fat. Why don't we have suction on the tube, guys? This is not the first time today. You guys are not putting suction on the tube. That's that tube. We have a tube here that is not sucking. You know, we do the same surgery every single day. There is zero suction on that tube. Now we have, well, we had a split second of suction. Still no suction. I know, I mean, if it was something new, I could understand not having it, but when we do this over and over again, why is it we would not? Yes, now it's sucking. So what's the deal there? What was wrong? Okay. All right, so next time, let's check the lids, make sure they're closed all the way, so we don't have the same problem again. Okay? I'm a big believer in root cause analysis. Find out why you have a problem and fix it so it doesn't happen again. Okay, we're done. Yeah, scope needs to be sent out for repairs. Yeah, root cause analysis. You don't have to be a hospital to do a root cause analysis. I've been doing it since I was a freaking teenager. It's natural. Figure out the source of the problem. Good. That comes from the man who taught me we don't do cosmetic spine surgery. I love that. That's my favorite for the year. That takes the cake. We don't make your spine look good. We make it feel good. Okay, so you guys see the incision? That's it.
We see it,
The whole
yes.
surgery, 5 years of back pain suffering is gone with literally 30 minutes and a 7mm incision. And now our Canadian can go back to the good spot. Good job, Nikki. And have his fettuccine Alfredo. Little pressure. Make sure you put pressure, okay? Pressure keeps you from getting any blood clots in the muscles. Muscular blood clots are not life-threatening or even needing surgery, but they cause pain for the patient that lasts months. Our EBO is 0.5 mil. That's 10 drops of blood. No complications. Let's go ahead and show them a testimonial, and I'll come over there. Good morning, it's February 22nd, 2023. I'm Dr. Deuk and I'm here with one of my patients who traveled to Deuk Spine Institute, not too far away from Jacksonville.
That's correct.
Yep.
That's where we're from.
You found out about Deuk Spine through the internet,
Yes, I did.
and why did you end up coming here?
I ended up coming here because I could not get rid of the pain that I had in my back and in my leg. I tried to exercise. I tried every physical therapy, yoga, everything you could think of, and I just could not get out of it. It just would linger and linger and linger, and it wouldn't go away.
How long have you had that back pain for?
This back pain has lasted me for the last 6 years. It started when I was working at the garden stores, doing a lot of heavy lifting. I took some time off from it, and then I jumped back into work, and the pain, just when COVID hit, I just had gotten a job in the garden, took another job in the garden store, and shot down my leg, and it's been like that. The pain's been like that for 2 years. So, you know, now it's 2023, and came here to see you, and yesterday we had it done, and in 1 day I'm doing a lot better now.
So you had the Deuk laser disc repair done yesterday at L4-5, L5-S1. You could see us in there with a tiny 7mm incision, the endoscope and the laser, cleaning out your disc. And clearly, to me, the disc did look injured, like they were about 5 to 10 years of injury. So it's been going on for a while for you. And you have degenerative disc disease. So a lot of people ask me, does the laser surgery work to get rid of back pain and leg pain when it's degenerative disc disease? What would you say? Sitting here now.
Yeah, I mean, my worry was that, you know, the disc had gotten just so bad that it wasn't really replaceable, that, you know, I was recommending a fusion. And I certainly did not want that. When the pain came on, I researched and found you and said, no, I don't have to do that. I don't want to have to do that. That's just not right.
Yeah, so you have degenerative disc disease at L4-5, L5-S1, but you had back pain coming from them. We did the laser surgery. We didn't do fusion. Is your back pain still there?
No, it's gone. It's gone.
Yeah. And the pain in your right leg, down the back of your right leg, is that still there?
That's gone.
Gone. Now, is it gone because we put you on narcotic painkillers and you're loaded up on morphine right now?
Yep. No pain medicine, no anything.
So what did you take after the surgery? You took a Tylenol?
Tylenol.
Robaxin? Okay, and we really have just finished our Deuk laser disc repair L5-S1 on our Canadian patient for the day. He's been having lower back pain at L5-S1 for 5 years. The disc injury looks older. It's older than 5 years, that's for sure. Probably more like 10, 15 years. So like many disc injuries that don't cause any symptoms at all, people get an injury to the disc, it traumatizes, there's a tear, you start getting a scar tissue development or inflammation trying to heal the tear, and in many people that doesn't hurt, it's painless. So there's this process going on where their disc could be degenerating and they're not feeling it, all right? And that's the most common scenario with people. But some people do feel it. We don't know why those people feel it. I have some theories on it. Obviously, it involves pain nerves being activated in the back of the disc. That said, this is what we just did. This is the back of the spine. We came from the side on the left, and we went through the foramen, tiny little space, and then I did all my work through this little 7mm tube. This is actually a straw, but I used it to show you exactly how we do what we do. Questions?
This next question comes from, these next two come from, no, it's the same one, from Bullseye Savannah Cat on YouTube. Love that name.
Bullseye Savannah Cat.
Yeah.
All right.
I love it.
Thanks for joining us.
The question is, if you were to commit to bed rest while stretching and walking, could the annulus heal itself and the body process fragments? Found an article that 6 months of bed rest increased the disc height. And can you tell that on the MRI?
Yeah. So first of all, this whole notion that bed rest can fix your back pain, 100% bad. Never do that. I mean, I don't know. That's like saying, I've got a rattlesnake in my house. I'm afraid I'll get bitten and die. So I'm going to wrap myself in aluminum foil so that I've got that thick of aluminum foil on every inch of my body. So if it bites me, it can't get me. That's what bed rest for 6 months for back pain is. It is just craziness. Craziness doesn't even describe the right word. Craziness is too generous, too kind. Bed rest doesn't fix back pain. Bed rest is going to make you a lot worse, because when you're bed rest, you're not using muscles, You're not making a living. You're not active. You're not living, period. You're in bed. You know, I mean, there are things you can do in bed for 6 months that, you know, you could justify being in bed for 6 months. You know, if you're in that type of a job where, you know, you're in the entertainment industry. But most of us, if we're in bed for 6 months, it's pretty bad. I'm sorry, but some of these questions are great, and I'm glad you asked them. But just the thought of being in bed for 6 months, I would think I would just, you know, not be able to do that. I don't think most people would. If there are doctors telling you to be in bed for 6 months, those doctors, we need to put them in a little boat and ship them off onto the ocean into the horizon and never see them again. That's craziness. We could fix the disc in 15 minutes, and then you can go back to having a normal life. Of course, you have some restrictions for the first year while your disc is healing, but you're not at bed rest. You're out working, you're, you know, going out and having fun, doing great things, enjoying life, living life. After all, that's what it's really about. So bed rest will not heal your disc. You may feel less pain in your disc after 6 months of bed rest, but after that, you're going to start getting active again, and the pain's going to come back. I guarantee it. I've seen it over and over thousands of times in patients. So bed rest is not the answer. Debridement, let the disc heal. That is the best treatment in the world. It's what we're doing here at Deuk Spine.
Next question comes from Becky on Facebook.
Hi, Becky on Facebook again.
They asked, I came in late on this surgery, so how did you determine which one of the discs was injured here, and can that be caused from a previous injury?
So great question, Becky. It's really important to understand I never determine which disc to operate on in surgery. I do that in the clinic. I do that ahead of time. And about 80% of our patients that you see us operating on every week, 80% came from another state or another country. And I made the determination about which surgery they needed over a Zoom call with their MRI available for me to look at. So all of that determination of what needs to be done is done virtually through a Zoom call with the MRI and their history. Now, sometimes people come here and I can diagnose they need this disc and this disc fixed, but then they get here and, oh my gosh, you've got sacroiliac joint pain as well. I couldn't know that because I couldn't examine them properly over the Zoom. So I could certainly add a few things when they get here and I examine them in clinic, but by the time I'm going to the operating room, I already know exactly what I'm doing. I don't change the game plan. It's kind of like when you're playing football and the coach gives the quarterback a play, and the quarterback goes out there and tells everybody in the huddle, this is what we're going to do. You never change after that. You're not supposed to change after that. You're supposed to do the play. And we don't change the game plan. Now, sometimes we get in a situation where I can't do what I set out to do. Like, let's say I was going to do 5 things in the surgery, but I couldn't do one of them because the patient's anatomy just didn't allow me to. I couldn't do it. So we'll abort that. We won't do it, but we won't start adding things on during the surgery. Now, I know there are some surgeons that do that kind of stuff, and I could tell you 100% you should avoid those kinds of surgeons, 100%. A good surgeon knows what they're going to do before they do surgery. There is no such thing as exploratory, hey, let's get in there and see what we see and start doing stuff. If you have a doctor that wants to do that, there's a problem. Now, of course, I'm talking about spine surgery. And of course, some people go to the hospital, they have a peritonitis, they have an inflammation in their belly, and the surgeon says, we got to go open you up in your belly and look around and see what's going on. You may have a ruptured appendix, you may have a gallbladder, you may have an ulcer that's that's perforated. Point is, that's a different kind of surgery. But when it comes to fixing people's backs and necks, the surgeon should know exactly what they're going to do before they go in there. Now, I've seen some spine surgeons add things on during surgery. That's because, not me, but because they did the wrong level. They went in, they thought they were at the right disc, they did surgery there, and then they went, oh shoot, they had that oh shit moment when they look at the x-ray and they're like, I did the wrong disc. We better do the right one. So then they go do the right one. Now they did 2 discs instead of the one they were supposed to do. Oh yeah, this happens all the time, trust me. And just talk to people out there. They'll tell you, yeah, the surgeon was supposed to fix number 5-6, but they said they had to do number 5-6 and number 6-7 because 6-7 was so bad. No, that's because they did the wrong level. They realized their mistake, and rather than wake you up and tell you what they did and then have to go back and do 5-6, they just do 5-6 and then tell you they found more bad stuff. So you got to be careful. There's a lot of scammers in this business, and they're dishonest. Fortunately, I've never had a wrong level surgery. I use the very best equipment. You can see the discs quite well with my x-ray machine. I buy the best x-ray machines. They're very expensive, $160,000, $170,000 for that machine. But there are a lot cheaper machines out there that I could buy instead and save a lot of money, and I could use that money to buy a new Mercedes or whatever, but then the x-ray pictures are very blurry and I can't see that well, and I might operate on the wrong place. So for me personally, as a doctor doing surgery, for me, I want the best equipment, the best people, the best drugs, the best supplies, the best of everything, because I want the best chance that I'm going to fix my patient's problem and not have a complication. So I would rather spend the money where it needs to be spent, which is on, good medical supplies, equipment, staff, whatever, and I don't cut corners. Most doctors will cut corners because, well, they're not as committed to results as we are. Next question.
Next question comes from, all these next questions come from Bullseye Savannah Cats on YouTube. The first one they ask is it bad to burn off all these fat deposits if they've been helping?
Yeah, is it bad to burn off the fat deposits that they've been helping? So, great question. The answer is you don't want to burn off the fat deposits, but sometimes the fat billows out and it blocks my view. I can't see what I'm doing, so I've got to burn a little bit. But if you actually saw how much fat I burned, it's quite literally about 3 millimeters of fat, which is like literally that much fat. It's nothing. You blow your nose hard enough, you burn more fat than that.
All right, next question. Would there be any negative nerve sensations later if you remove fat that's been caked on the nerve for a while, or C5 palsy type things? What that means?
Yeah, so no, there's no problem removing a few fat cells while we're there. It doesn't do anything. My God, plastic surgeons go in and they suck out 1,000 times more fat than that, and patients do fine. Actually, people pay doctors to remove fat. I don't even charge you. It's free. But there is no problem with removing a few fat cells. That said, as far as a C5 nerve palsy, we don't get C5 nerve palsies. We can actually see the nerve. We're not damaging it. That's why we don't get C5 nerve palsies. I'm always honest with you guys, and I have opinions. Obviously, they're opinions. You go somewhere else, you'll get a different opinion, okay? I'm okay with that. They're my opinions. But you're getting the opinion of a surgeon who's been doing this for 26 years. And I have never had a C5 nerve palsy. And I've done 1,000 fusion surgeries on the neck. And I've done 500 in the back, PCDFs. And I've done another 600 cervical endoscopic laser surgeries on the discs. So why have I not had a C5 nerve palsy, whereas other surgeons have them a lot? Think about that. It's obviously because they're damaging the nerve during surgery. Their technique is not good. Maybe it's their equipment. Maybe they have a cheap fluoro they're not able to see. Maybe they're using the wrong scrapers. I mean, there's so many things you can do to hurt patients during surgery with your technique or with the instruments you're using. So I have thought through every little detail of what instruments I use, what drugs I use, how I position the patient. Do I put the neck like this? Do I put the neck like this? What's the right way to position? What's the right way to do the surgery, every little step. And I paid attention to every little detail because I found that by managing the details properly, you can have the best results possible. But if you deviate just a little bit off that line of the best, then you get catastrophe. And the catastrophe is always for the patient. It's never for the surgeon. The surgeon walks away and goes home and, you know, they watch TV and they drink their highball and they're done. But the patient has to live with the catastrophe for the rest of their life. So I am very, 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 very detail oriented, and I have over the years developed a very fine level of, should we say, nuance to the way I do my surgeries.
Next question, is there a bone spur always a sign of degeneration?
Yeah, is a bone spur always a sign of degeneration? 100% yes. If you see a bone spur around a joint, it's always a sign of degenerative joint disease.
Do you ever have back pain, Dr. Deuk?
Do I ever have back pain? Yes, sometimes. The most common reason I have back pain is viral illness. So a lot of people don't realize this, but the number one cause of neck pain or back pain really is a virus called the GI virus, gastrointestinal virus. For some reason it causes meningitis, for example, in your neck, and headaches. So a lot of people get viral GI viruses where they infect the gastrointestinal tract, cause diarrhea, lose stool, but they also can cause neck pain, stiffness, and it hurts. So sometimes I get a stiff back when I have a virus that's transmitted from somebody to me, and of course it goes away after a few days. But other than that, I don't have back pain, thank God. I feel very fortunate. I do have hip pain in my left hip. I have an old soccer injury. I used to play on the United States national soccer team, the junior team, back in the 80s, and I injured my hip. I was a forward. I was a top goal scorer. Unfortunately, back then they didn't pay professional soccer players much money. It was kind of not a really good career. So I ended up going to medicine instead. You wouldn't be able to support your family playing soccer back in the early 80s. But I did hurt my hip, and it's one of those things where it got better for many years. I didn't have any hip pain, but then a couple of years ago I was running, jogging, trying to stay in shape, and I started getting hip pain. So it's kind of like the disc where you injure it, you know, and then years later it starts hurting more, just like this patient that we just did surgery on. His disc injury is about 10 years old, but he hasn't had pain except for the last 5 years. So he had a period of time from the injury to when he started having the pain where he didn't have any symptoms, and he was doing what he wanted to do. Very common for joint injuries. You injure the joint many years in advance, you have an asymptomatic period where you don't have symptoms, and then inflammation starts getting in and causing symptoms and pain. So thanks for asking, but no, I don't have any back pain, but I do have hip pain. Give me 1 second. I can take that later. Okay, next question.
Next question. I work from home, so I'm lucky, but I can't sit in a chair upright without having pins/needles down the arm and pain/compressions. So lying at a recline helps. I get up and do PT stretching and walk around. Do you see a difference in anxiety levels between cervical, thoracic, and lumbar? Cervical is related to anxiety according to chiropractors and parasympathetic system. Wondering if that was true.
So this person is asking an interesting question. They're saying, you know, of course they're suffering with a problem with their neck. They have a herniated disc. They're getting radiculopathy down the arm, which is basically irritation of the nerve root down the arm from the herniated disc, and maybe some muscle spasms going on. And they're asking, do I see a difference in anxiety levels of people, whether they have a cervical, thoracic, or lumbar disc herniation, and with the cervical maybe being more likely to have anxiety? It's a great question. I have to tell you, I see people with anxiety that could be completely incapacitating and really very difficult to live with cervical, thoracic, or lumbar disc herniations. And I can tell you folks, anxiety is incredibly powerful. It's really stress. As a matter of fact, Freud, the greatest psychoanalyst of all of our time, is like the Einstein of physics. You know, Freud is the person that studied anxiety. He said that all human behavior was driven by anxiety. Basically, Freud said that everything we do as a human being is because of fear and anxiety, being worried about something. Certainly pain in the neck, when you don't know what's going on, you're scared, you don't know what it is. I had back pain one time, years ago. I told this story already to you all in one of my broadcasts. I had my daughter or son on my shoulders in a pool. I was chasing my other kid, and suddenly I had severe sharp pain in my lower back. It was right around L2, L3, and it hurt like crazy. I thought, oh my God, I've got cancer. I've got a fracture of my spine with cancer. So I went and got an MRI done, and it was just a herniated disc. And but prior to seeing that, I was freaking out. And I can't imagine what people go through every single day when they suffer with back or neck pain or thoracic pain. It's just terrifying. And there's no feeling greater than being relieved of your symptoms. So that's why Deuk Spine Institute is completely dedicated to curing back and neck pain, because we know how incapacitating this pain can be. Not just the pain, but the fear and anxiety that comes with it. It's just horrible. I suffered from anxiety, not just with that one incident, but I had a horrible obstruction in my nose. My soft palate was blocking me from breathing, and I got sick with an upper respiratory virus. This is like 2 years ago, and I could not breathe. And I was laying in bed, and every time I fell asleep, I would literally stop breathing. So I was scared to death. It was horrifying, and I'm a pretty intelligent, calm guy, but I was panicked. I mean, it was massive anxiety. So if it can happen to me, it can happen to anybody. You know, I've been through the fire. I've been through basically neurosurgical training is like Navy SEALs don't have it that bad. Trust me. Neurosurgeons, it's killer. Mentally, physically, emotionally, it is the most stressful training in the world. So we come out very, very tough. And you know, I could tell you that anxiety just about broke me. So I understand what you're all going through when you have anxiety, and I want to help you. That's why we're here. That's why we broadcast. We want to get the word out. We want to get the message out. Thank God I got my sinus issue fixed, and it doesn't happen anymore. I had to have surgery for it. Actually, I had to have 4 surgeries for it. I've had my 4th one, and I'm doing pretty good. So I'm really, really happy about it. Any other questions?
Yes. The next question, do you see that cervical disc issues pressing nerve roots cause weakness and issues in the legs too?
Yeah, cervical disc issues are herniated disc in the neck. They can go backwards and hit your spinal cord and cause weakness in your legs, but it's not common. You'd have to have a really big herniation. You'd have to be crushing the spinal cord really bad. I don't think that would be the cause of your leg weakness, but it could. The most likely cause of leg weakness would be a separate problem down in the lower back, like a herniated disc, stenosis, pinched nerve, causing leg weakness. So I would get an MRI of the lumbar spine to check for that.
And then last question from Bullseye Savannah Cats. Wonder if the rhizotomy treatment on your hip would help as well.
Yeah. Bullseye Savannah Cats. Very, very, very perceptive. That's why I created the rhizotomy treatment, was for my hip. And of course now we're doing it in everybody, and I'm watching the results. So yes, someday I may be the recipient. But I was thinking, I really don't want a hip replacement. There's got to be a better way. So you have unlocked something, a very big secret, which is what drove me to develop the Deuk plasma rhizotomy procedure for the joints was my own hip pain and not wanting to have open surgery. I was afraid of having a metal hip being put in. So I created this whole idea, and now we've been doing it, and the people we've been treating have 100% hip pain relief. I will tell you this, my hip pain is not bad enough to do it. It's like not all the time. It's probably 10% of my life. And it probably keeps me from going jogging, but I go biking now instead. And so someday I'll probably do it, but not yet.
And that is it.
All right. You guys are awesome. I really enjoy our time together, and our patient is probably already ready to go home by now. We just finished his surgery, and we've been talking for so long. But have a great day. We'll be back on Thursday. We have a full schedule Thursday. How many cases? Like 4 or 5?
4 or 5, yeah.
Yeah. So more Deuk laser disc repair and Deuk plasma rhizotomy. We'll be opening a new center in Orlando in 1 year, and then we'll be expanding again after that with even a bigger center. And you can see I'm promoting the Deuk Joint Institute because we are able to do the Deuk plasma rhizotomy for hips, knees, and shoulders, and someday my hip as well. Have a great night.